Be wondering, well, what are the symptoms someone could have if they were worried they had POTS? Well, lightheaded, they often feel faint, dizzy, heart palpitations because their heart's just chugging along, especially when they go from laying to standing or sitting to standing. They're usually tired. Usually, some of the simple things just wear them out. They'll often notice visual changes. Their vision just doesn't seem right. They'll go to an eye doctor. They've got fuzzy, blurry vision. They'll often have nausea, near fainting. So they feel if they don't go and sit down or lay down that they're going to pass out. Now, there are those that are really bad where they will pass out as a result, but near fainting is enough. Headaches, anxiety, and there's even more. Now, the hard part when we look at what should not be there beforehand, that could cause it is anxiety can cause a lot of the symptoms of POTS, but POTS also can cause anxiety. So we really make sure we're attributing the right thing to what. Now, you may be wondering, who am I? Well, I'm Dr. Spencer Zimmerman. I'm licensed as both a doctor of chiropractic with a diplomate in chiropractic neurology, as well as a family nurse practitioner. And I've been helping people with brain-based issues for over a decade now. And I've learned a lot along the way, and I'm sharing this with you because I do see a lot of patients who are struggling with POTS, and they've done everything that they've been told up front. Normally, the treatment for POTS for most people is compression stockings, increase your salt intake. If your heart rate's going crazy, they'll get put on a beta blocker or something else like that. Now, I get those who are not getting better. So I'm not going to spend a lot of time on the hypovolemic because a lot of those people end up at cardiology and they can do well with that. Whereas I see the people who tend to have the neurological as well as the immune system based POTS. So now we've talked about the symptoms that someone can have with POTS, right? There's primary POTS, there's secondary POTS, which we've already said, mast cell related issues. Diabetes, infections can cause it. So there's been a lot of issues with COVID where those individuals end up with POTS. We have associated things. So these are people who are set up for POTS. So Ehlers-Danlos syndrome, chronic fatigue syndrome, brain injuries, concussions, TBIs, as well as migraines.